Everyone, welcome back to my YouTube channel. Now we will talk about the effects of alcohol. Ethanol is consumed at least partially are its mood altering properties, but when used in moderation, its effects are socially acceptable and non injurious. When excessive amounts are used, alcohol can cause marked physical and psychological damage. Here we will describe the lesions that are directly associated with the abuse of the alcohol. Despite all the attention given to illegal drugs, alcohol abuse is a more widespread hazard and claim many abuse is more widespread hazard and claim many more lives. 50% of the adults in the Western world drink alcohol and approximately 5 to 10% have chronic alcoholism. It is estimated that there are more than 10 million chronic alcoholism in the United States and that alcohol consumption is responsible for more than 1 lakh deaths annually. Almost 50% of these deaths result from the accident caused by drunken drivers and alcohol related homicides and suicides and 15% are consequence of cirrhosis of liver. After consumption, alcohol is absorbed unaltered in the stomach and small intestine and then distributed to all of the tissues and fluids of the body in direct proportion to the blood level. Less than 10% is excreted unchanged in the urine, sweat, and breath. The almost exhaled is proportional to the blood level and forms the basis for the breath test used by law enforcement agencies. A concentration of 80 mg per deciliter in the blood constitute the legal definition of the drunken driver in most states. For an average individual, this alcohol concentration may be reached after consumption of 3 standard drinks, about 3 12-ounce bottles of beer, 15 ounces of wine, or 4 to 5 ounces of 80 proof distilled spirits. Drowsiness occur at 200 mg per deciliter, stupor at 300 mg per deciliter and coma with possible respiratory arrest and higher levels. The rate of metabolism affects the blood alcohol level. Chronic alcoholics develop a tolerance of alcohol. The metabolize alcohol at a higher rate than normal and has show a lower peak level of alcohol than average of the same amount to alcohol consumed. Most of the alcohol in the blood is metabolized to acetaldehyde in the liver and by three enzyme system: alcohol dehydrogenase and catalase. The main enzyme involved in the alcohol metabolism is alcohol dehydrogenase, located in the cytosol and hepatocyte at high blood alcohol level. However, the microsomal ethanol oxidizing system also play an important role. The system involved is isoform located in the smooth ER. Induction of the alcohol explain the increased susceptibility of alcoholics to other compounds metabolized by the enzymatic system include drugs, anesthetics, and others. Alcohol is present in the blood at high concentrations and delay in catabolism of other drugs. Penetrating their effects catalyze is of minor importance, being responsible only about 5% of alcohol metabolism. Acetaldehyde produced by these systems in turn converted by acetaldehyde dehydrogenase to acetate, which is used in the mitochondrial respiration chain, and the toxic effects are alcohol oxidation of the alcohol dehydrogenase causes a decrease in the nicotinamide adenine dinucleotide NAD and used in NADH reduced form of NAD plus, and NAD is required for the fatty acid oxidation in the liver. Deficiency is main cause of the fat accumulation in the liver of alcoholics, and increase in the NADH by NAD plus ratio in alcohol also cause the lactic acidosis. And then toxicity responsible. Some of the acute effects of the alcohol acetaldehyde metabolism differ between the population because of the genetic variation. Most notably, about 50% of the Asians express a defective form of staldehyde dehydrogenase after ingesting alcohol. Such person experience flushing, tachycardia, and hyperventilation, and ROS generation. Metabolism of ethanol in the liver, CYP2E1 produce ROS and lipid peroxidation of cell membrane. Thank you so much for watching the video.